Hey there, Sam Visnick here, Release Muscle Therapy. In this video, we're going to be covering the shoulder, the issues that can present with it, and how we deal with this here at Release Muscle Therapy. So to get started, we're going to talk a little bit about the anatomy of the shoulder so you understand what's going on. And I don't want to go through this completely as an A to Z because there's a lot of material to cover in here that would be a very long video, but I do want to give you the gist and the overall so that you understand how I address these issues. So first and foremost, important to understand how the shoulder actually sits on top of the body. A lot of people don't know this, but the only actual joint that we have that keeps that arm sitting on the body is right here in the front. It's where the clavicle here meets the sternum. We call this the sternoclavicular joint. And if we were to actually take that off, pretty much the entire arm would come off of the body. Now that's not exactly how it works, but you get the idea in terms of when it comes to a joint, okay? The rest of this is a lot of muscle. As we take that clavicle all the way over here, it actually connects with the top border here of the shoulder blade, of the scapula, and it makes a little joint right there. Then underneath it, we see that the bone here of the arm, it's called the humerus, actually sits in here in that cup like a ball and socket, okay? When we go around the backside, then we really don't have a joint here, do we? Okay, we have the scapula, the shoulder blade that sits on top of the ribs, and it does that through muscles, okay? So all of the backside of the shoulder here and connecting into the spine and the neck is all muscle. So there's a lot of muscular influence here over the shoulder, okay? And I say shoulder as a whole, meaning this whole structure, but in particular, the muscle connecting between the skull, the spine, and the shoulder blade, and then we have muscles that go from the shoulder blade to the arm, etc. Okay? Now, there's a lot of different issues that can happen as a result of shoulder injury, but the most common ones that I hear and I see are people with rotator cuff tears, okay? And that could be here, the rotator cuff muscle on the backside, or the one that comes through here over the top called the supraspinatus. There can be tears. Rotator cuff impingement. That's where underneath here, the tendon of the supraspinatus can be getting impinged, right? Underneath there, it can cause pain. People will have bursitis underneath there. There could be injuries to this acromioclavicular joint or here, okay? Or there can be problems with the front portion of the shoulder. In here, we would call labral type injuries as well, okay? And then there are other types of issues like frozen shoulder and so forth. Now, no matter what kind of issue is going on here, when we're past the acute stage, and I'm talking about chronic, long-term here, a lot of the manifestation of this, of the muscle tension patterns that we find are very similar, okay? So the body will tend to go toward tightening the same muscle groups when there's anything wrong with the shoulder. Not 100% of the time, but most of the time, okay? When you go through therapy or you see exercises and stretches online, they seem to be of the same kind of variety, which is basically stretching the chest, which is turning on the rotator cuff muscle, and so forth. Okay, and those generally will help the process dramatically in terms of improving the function of the shoulder, but a lot of times it doesn't get you there 100%. It's always that last 20 to 30% that keeps you feeling restricted from doing your activities, okay? So what I'm going to do is to show you what we do here at Release Muscle Therapy, i.e. myself at the moment, and how to restore full function to the shoulder. Number one, what we have to have is an appreciation for the position of these things. Now, before we go further, I always have to say that chronic pain is a complex animal. There's a lot of things that can contribute to chronic pain. Okay, some people have perfect biomechanics in the shoulder, right? And everything moves just great, and their shoulder has a lot of pain. That is possible. At the same time, we could have a shoulder that's not positioned really well, and the person generally feels fine until they move in a certain position. Let's say where there's impingement, they move and it feels like it pinches, right? Or there's pain produced during specific activities. So in that situation, we can improve the mechanics and the activity of the movement of the shoulder, and that will reduce that sensitivity because it will gain more range of motion before we feel that area that is stressed, okay? So we're always trying to improve position, improve function and strength, and get more pain-free range of motion, okay? So when we look at this, the muscles in particular become very, very important. A lot of times people are familiar with this large pec muscle here called the pec major. And the pec major does this kind of fly activity. We're familiar with it doing pushing motion. And that can certainly be a restriction because it can stop us from opening and bringing our arm back, okay? Muscle there that's probably even more important that rarely gets addressed is called the pec minor. And it's a muscle that goes from this little bone right here and then goes downward in these strands like this and attaches on the ribs. This little muscle in particular, very strong, has a lot of leverage. It will take this bone and it will pull it down and forward. So a lot of times what we think of in this is the easiest way to consider it is the pec minor will cause the shoulder to dump forward like this. Now, how many times do you see people walking around with a shoulder that looks like this? A pretty good amount, right? So when it dumps that shoulder forward, it takes the shoulder blade in an anterior tipping position. So it causes it to go like this, okay? Now the problem with that is if you can imagine that shoulder or that shoulder blade being tipped forward like that, it changes the position of the socket so that the ball is going to sit in the socket in a different way. And that can cause limited range of motion in certain directions, okay? Now, when we see this sort of situation happen and the shoulder is not positioned really well and people will do presses overhead and they have pain, they try to bench press and then they have pain and so forth, all right? So if we just focus on strengthening the opposite muscles, which is a common strategy, which is doing rotator cuff work and rows and so forth, the problem is that these don't always directly get a release or an improvement in the pec minor situation because the pec minor tips down and forward and there's not a lot of exercises that will directly like antagonize that. There are, but they're not very clean. They're not very good selections. So a lot of times what I need to do is to manually go in and relax and release that pec minor and to assist with getting that shoulder blade properly positioned. The idea is to figure out, is it a pec minor issue and how many other soft tissues, muscles and so forth, are antagonizing what I'm trying to do, which is to get that scapula to go back, okay? A secondary consideration there is how well the ribs move. If the ribs do not move very well, which is very common, and I'm not going to dive into it too much in this video, but if the rib cage does not move very well for respiration or breathing, that pec minor might continue needing to be tight to lift those ribs up. And if that is happening, it's going to be very hard to get that corrective work to stick if I don't address some of those issues, okay? Now, on the backside, when we talk about ribs, we have to be aware of spine, okay? The thoracic spine, where a lot of those muscles attach, including the rhomboids, the trapezius muscle, and the lats are coming down across here, but also the lower trapezius, okay, is that if there's a distortion in the position of the thoracic spine, in particular, where we have a lot of kyphosis, where we're really rounded. So even if I don't pull my shoulder forward from the pec minor, if I slouch, it changes the position of my shoulder blade or my scapula on top of my ribs. And that will lead to some of those still challenges that we're seeing, right? If I stand upright but my pec is tight, it causes this. But if I don't do anything with my shoulder and I slouch, we're still kind of in the same position, but for a different reason, okay? So we have to be aware of limitations and of mobility and so forth in the thoracic spine, okay? The neck is the other thing to consider. If there's issues going on with the neck, that will oftentimes lead to the upper trapezius and the scalene muscles being like this, kind of pulling the shoulder blade up. And when the shoulder blade goes up, it doesn't go straight up. What it does is it goes up and it tips. So we're still kind of in that same situation, aren't we? So like I said, that no matter what's going on, a lot of times we see that same presentation of the scapula kind of being tipped forward and the shoulder being in this position, but we don't know which thing is actually causing that. So we have to rule it out. We have to go through and we have to do a real proper assessment and figure out which of these structures are contributing to that situation, okay? So once we do that and we go through a thorough evaluation to look at the relationship between these elements, a lot of times the first thing I will do is do what I call a full shoulder clean out. So what this means is I will literally, from a massage standpoint, go through every strand of muscle fibers in every one of these attachment points all around the shoulder to see what's sensitive, what's sore, but also to see how fast things improve. It's not uncommon for me to see baseball players, volleyball players, lots of different throwing athletes with shoulder problems have gone through lots of therapy, have seen lots of people, and nobody has really ever done this routine where they've gone through and worked on every single muscle in the shoulder to see what the contribution is. So if I release a muscle or work on a muscle and then I have you test a limited range of motion previously, we see what makes it better. And that gives us an idea of how much something might be contributing to the reduced range of motion and function. So once we do that and we go through that full routine of working out everything in the shoulder, we'll oftentimes, number one, get a great deal of relief, but number two, it gives us a good idea of which tissues we need to work on. Once that shoulder is in a better position and the scapula is in a better position, we'll start doing reconditioning exercises to train the nervous system on how to hold that position. Okay? Might involve stretching, might involve, of course, doing exercises, but also might involve doing some mobilization work, self-mobilizations and so forth for the thoracic spine or the ribs or other areas that are directly or indirectly contributing to that positional problem with the shoulder. Okay? So a lot of these things are not being optimized in most therapeutic programs, not being addressed, and it's just purely a lot of times a lack of thoroughness. Okay? So at Release Muscle Therapy here, my job is to go through all of those little things and to rule out which things might be contributing to that last, again, 20 to 30% of shoulder, I should say, not necessarily dysfunction, but lack of optimal function. Okay? So that's what we do here for the shoulder. I hope that was helpful. A lot more details coming up. Again, I don't want to make the video too long, but these are the primary areas that you have to address. If you have any questions, feel free to reach out. Sam Visnick here, Release Muscle Therapy. Thanks for watching.